Okay, so Christine, I'd kind of like to know, how did you finally arrive at the decision that was right for you, which was to go ahead and move forward and get vaccinated?
There was a lot of back and forth. I know we talked about it. I talked about it with Dr. Winkler, one of our other high-risk doctors, too. I would say my initial thoughts when I heard that we were going to have the vaccine available was that I wanted my husband, who also works here at South, to get vaccinated immediately, and that I was going to wait until I delivered. I think at that point, some of our professional societies like ACOG and SMFM hadn't really come out with statements on the vaccine quite yet. And my thought was it was not just my decision because I'm affecting, my baby. As time, and I would say too, the other thing was at that point, we were kind of seeing less COVID patients. This was prior to Thanksgiving and the spike that happened after the holidays. And so I have wonderful co-residents, and typically when we had a COVID patient, they would say, like, I'll take care of that person, don't go in there. So I was able to avoid it a little bit more, so I felt a little bit more comfortable. But then after Thanksgiving, we started seeing like very rapidly rising cases, and I was, I have to be able to take care of my patients, and also I wanted to feel safe doing that. And by that point, both ACOG and SMFM had come out with statements saying that they believe that for frontline workers, that just discussing it with your doctor, having that shared decision making, that they were recommending that. For women, around the same time, I started reading into it, and like you had mentioned earlier, the CDC considers pregnancy a high risk condition for when you have COVID, and we were starting to see that pregnant women were more likely to be, ICU status, on ventilators, ECMO, all of those things. And so I kind of weighed that, and my husband and I discussed and basically decided, there's never going to be a clear, correct answer with anything in parenting, and we're going to be first-time new parents. And so this was just really one of the first things. And he felt that, and I felt as well that me being safe and healthy would be the best thing for my baby. So that's finally, why I ultimately decided to do it, is just, I'm trying to take care of myself in many ways while I'm pregnant, working out, trying to eat better, trying to limit my caffeine even though I'm a resident. And so I just really thought this was kind of just like a natural extension of that, keeping myself healthy and protected to protect my baby as well. I was 24 weeks when I had my first vaccine, so, 24, 26, either way. So I felt comfortable with the decision. I'm glad I did it.
And I heard another physician talking about, when, in her decision-making process, and I don't know if you struggled with this, but one of the things that she said was, when I have my baby, my elderly parents are going to come help me. My elderly in-laws are going to come help me. And so if I get COVID, I may, give that to my family. And, that helped in her decision-making process, too. I mean, was that something that sort of crossed your mind as well?
Yeah, absolutely. And my parents are both older. They actually recently retired and moved down to Ocean Springs, so they are planning on helping us out when they can, at least like once a week or so. And I do worry about that and exposing them. They haven't gotten to get their vaccines yet. So it's just nicer to have kind of my own little vaccinated bubble around our baby. Just like we talk about with Tdap and whooping cough vaccines and stuff like that. I think it's really like a similar thought process.
And what people may not realize is that we've been giving pregnant women vaccines for years. When after we had terrible flu, 10 years ago, we started vaccinating women, pregnant women for flu. And then, as you mentioned, the Tdap to help protect the baby from whooping cough. So, we have a lot of experience with vaccines in pregnancy, and so far the data have shown a lot of safety. So again, I think that we can be reassured that this will also turn out to be similar. Although again, we can't be 100% until we see what happens long term after people like yourself have gotten the vaccine, and we do long term follow-up studies. But again, I think we're all encouraged by the science and believe that that definitely the benefits outweigh the risks for especially people involved in frontline healthcare.
And that was kind of my ultimate decision, was just I was weighing known benefits of getting the vaccine against potentially unknown risks, to the baby that we're not sure about, and we believe it's safe. So to me, they were more minimal. I think the other thing too is, especially, you're a MFM, and it's maternal and fetal medicine, right? We need to care about mom, and we always talk about like healthy moms, healthy babies, right? And so if mom is healthy and protected, then baby is as well. So
exactly,
that's kind of my thought.
Right.
Yeah.
So and I totally agree with your decision, because I think again, somebody who's on the front line and is at risk to get COVID and get sick probably really needs to consider it. If you came to me and you said, I work from home and Zoom every day, and Publix delivers my groceries, I wouldn't feel as strongly about encouraging you to get it. So I think it just depends on the person. Again, I think that's why this needs to be a shared decision with your healthcare provider, and knowing that there are unknowns about this, but weighing them against potential benefits of staying well is important. So, I think you made the right decision.
Thank you, Dr. Munn.